Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 36 weeks pregnant. So we're coming up here in a month, and this is the time where you might start to feel a little anxious, excited, because again, baby could come anywhere from maybe 2 weeks to 6 weeks if baby's a little bit late. So we're getting excited, also a little bit anxious as well too with the birth. So at week 36 is typically the time women are getting tested for Group B strep. So this is done in office, and what they'll do is they'll swab an area in the vagina as well as the rectum and send it off to the lab. So if you test positive for Group B strep, they typically will recommend doing IV antibiotics while you are in labor, and this is typically 2 doses administered over 8 hours. And they'll use penicillin unless you have an allergy to penicillin, and then they typically will culture the Group B strep to see what it's sensitive to for you. Clindamycin, clindamycin is usually their second option for those who have a reaction to penicillin. So concerns if you are positive for Group B strep, it does increase risk factors for baby. So now they say anywhere from a quarter to a third of women will test positive for this in their pregnancy. And of that, 50% of the babies will be exposed. Now, of that 50%, 1 to 2% will develop some serious complication. So even though, again, it is rare for babies to develop complications, if they do, they are quite serious. So they include pneumonia, meningitis, sepsis that can be fatal for baby. So again, this is it is a concern. But we have the other side of the coin where it is a concern if mom's being administered antibiotics during pregnancy, that it is going to disrupt baby's microbiome and then make them at risk long-term for metabolic disease, allergies, asthma, and then other infections that they could acquire, especially during their hospital stay. So typically, again, you look at risk overall. So the concern is that if you do test positive and you go into labor prior to 37 weeks, risk for baby developing one of those serious infections is higher. The other thing is if you go into labor with any signs of infection, so fever, frequent urination, painful urination, or an odor when you urinate, those are all signs that you do have an infection. And again, baby would be at an increased risk. So the other thing too is if you're in labor and your water breaks and you labor for, they say 18 to 24 hours, again, that just increases risk that baby can be exposed to that Group B strep. So there are some things that you can do naturally, if you test positive for it. You can ask to be retested. Now, again, because it's that 36 weeks and you don't know, when baby is coming, if you'll have enough time for treatment, again, those things need to be considered. You can definitely try, natural therapies and then ask to be retested to see if that's changed your results at all. So again, a couple things that you can do, increase your probiotics. So usually I'm having people take 100 billion plus probiotic, specifically lactobacillus species that has been shown to kill off Group B strep. The other one is that you can insert garlic vaginally. So what you would do is you would take a garlic clove, not the whole garlic bulb, and you would, obviously peel that, and you could insert that vaginally every night. Other things that I've done for patients is make a compounded a specific suppository for them. So I typically do a coconut oil-based suppository, which coconut oil itself does have antimicrobial properties. It's also very soothing to the tissue. But in that coconut oil, I can mix a variety of different herbals, essential oils. A common preparation would include berberine, garlic, calendula, rosemary, thyme, and again, you'd make that suppository and you would insert that nightly. Ideally, you would do this 2 to 3 weeks before getting retested. Okay, once you kind of get tested and again know whether or not you test positive again. Again, it will just help in your decision-making process to choose what's right for you. But again, even though rare, if baby were to get an infection, it is quite serious and life-threatening. So it's something that, again, that you should have that conversation with your OB and midwife. And even if you are trying the herbal route first, again, you want to keep that communication line open with them, let them know that's what you're doing, and make sure you're getting retested. So again, you can make that appropriate decision so mom and baby are safe during labor and delivery.